The Mental Health Telephone Helpline is a confidential and anonymous service that's open to the people of Nottingham or people registered with a GP in Nottingham.
The majority of the callers that I speak to, they're after emotional support. Maybe we're the only people that they have the chance to speak to.
I'm actually a recovering alcoholic myself, and I found that years ago I took sort of the long way round to finding help for myself, which I eventually did find, but had something like this been available to me then, I wouldn't have hesitated in coming and trying to get the right help.
If you're feeling anxious, depressed, stressed or worried, we want you to give us a call. Once you make that call, you will receive a friendly and welcoming call handler.
Hello, Mental Health Helpline, how can I help?
Our staff team are from various different support backgrounds. Some people have worked with mental health, some people learn disabilities or young people services. And the Smart Service has been operating as a support service for about 7 years. So we are used to taking intensive calls from people with enduring mental health issue. The staff have got skills to identify quite quickly if a person is in crisis or is just in need of some general support.
We're trying to help them work out the best support that they need and where to go, different avenues to search, and just trying to create a bit of a support atmosphere for them.
Following people's initial call to us, we'll then try and generate a regular call pattern if we can, or we just advise the person to call back and speak to whomever, but we're always generating information on that person. At some point, it could be after 6 calls, it could be after 6 months, there's not a time scale on it. We will advise that person that we feel there's an organisation out there that can support them.
One of the pathways is to the Your Voice, Your Choice advocacy service. So for example, if you've got an important meeting that you're worried about attending, concerned that your voice is not going to be heard, then an advocate is someone that can come to the meeting with you and make sure that your voice is represented. Similar to if you're detained in hospital under the Mental Health Act, then an advocate can come and make sure issues you're worried about, such as medication or your rights being upheld, they can support you with those areas.
So the service is free, it's independent and it's confidential. And it means that when you get through to us, somebody can talk to you about the most appropriate way of helping. So that might be with some advice, it might be pointing you in other directions, or it might be about putting you in touch with an advocate who can then talk to you about how they can help.
We offer what we call Your Wellness Plan, which is an opportunity to help and help provide support for people using the Wellness Plan to empower them to change their life for the better. And it's a 3-day course done over three sessions, which helps. You can be done for yourself, it can be done for people with lived experience, people who are carers or loved ones or mental health professionals.
At Wellbeing, you'll receive a one-to-one service with a named individual that will see you through the whole process. We'll do some paperwork with you, we'll look at what you can do, and we call that a strengths-based assessment. From that, we will look at what it is you want from our service, whether you want some counselling help, whether you want to meet people, whether you want to try some group activities, or whether you would like to go back to college, get some more qualifications, or look at some work maybe.
We've had quite a lot of success with working with partner agencies once we've made a referral to make sure that they have been fully supported until the crisis is over or until the support need has diminished.
Brilliant, okay, you're keeping busy, that's good to hear.
And then the final part of that is that the caller knows that the support package is there, ready and waiting to kick back in for them. The ultimate aim is that at the end of a call, we have given some support, we have reassured a person, we have calmed situations down, and we've left people with the feeling that they can call us back or that they know that we will call them back.
Thank you. Okay, thank you. See you. Bye.
I was diagnosed with bipolar, so I went through the pathway which gave me more confidence, got me back onto a track, and got me where I am today basically, which is working and supporting other people with mental health illnesses.
If you've picked up a leaflet or you've picked up a card, you probably are quite worried about something, you probably are feeling a bit stressed, a bit anxious, a bit depressed, and you do need someone to talk to. I would say make that call. Your initial calls aren't generating any kind of documentation around you. It is just for you to get some support.